So let's talk a little bit about what bone overall looks like, and I'm sure you will hear a lot more in gross anatomy on this as well. But just to put yourself in the frame of mind in terms of what the bone looks like. So the ends are referred to as the epiphyses, the midshaft is diaphysis, and the parts in between the metaphyses. So what we are interested in is really around here on the surfaces. Here you have articular surface at the ends where the joints are forming, in this case represented by the blue line. Similarly on the other side here as well, the shaft itself is made up of bone, in which you have the endosteal surface on the inside and the periosteal or the surface on the outside, covered by this thin red line which is referred to as the periosteum. Bone itself is classified as two main types. You can have bone which is referred to as trabecular bone, which is also sometimes known as spongy, alveolar, or cancellous bone, and the other type being the compact, which is mostly forming the midshaft of long bones, and it's also referred to as lamellar, Resorption, or cortical bone. You can also classify them as immature or mature bone. The immature bone is also referred to as woven bone, and the mature referred to as lamellar bone. So this is a picture of a dry bone which is being sectioned to show you this very nice sponge-like structure, which we refer to as the tubercular structure, and you can imagine why it's called the spongy bone, because it does look like sponge. So if you were to zoom into one area within that, you will see this like what looks like a little bony structure with marrow surrounding it. So if you were to then label that, you will see that within it you have the osteocytes within the bone. You have the osteoblasts, which are on the outside. We don't have any direct evidence, at least here, of osteoclast, but if that was being remodeled or resorbed, you will see that on the surfaces, just like the osteoblasts here. But as I referred to you before, that cells which are not actively forming, but they are sitting on the surface, are referred to as lining cells. So they're covering the bone. So this little picture shows you all the features of that bone as we discussed earlier. So the other type is the compact bone, and this is where the midshaft of the bone is clearly demonstrated here. And if you were to then zoom into any portions of that, you will see this very thick structure of compact bone with marrow on one side, which will be the endosteal side, and then this thin layer of cells which are referred to as the periosteum. So this is the periosteal side on the outside. So looking in a little bit deeper into the microanatomy of bone, this little diagram here shows you that there are structures which are running parallel to the long bone. And if you were to look at that in a cross section, which is shown up here on the top, you will see a picture which looks something like this. So these are very well demonstrated by having these concentric circles of these dots, and we will see what these are in a minute, but just wanted to show you what it looks like as an overview of that cross section of cortical bone. So that actually is referred to as the individual units are referred to as osteon. So as you can see here, you have these concentric circles going around, and then these what looks like little ants or spiders. They are basically the osteocytes with their processes projecting outwards, communicating with adjacent cells here. This concentric appearance is what is giving it layering effect, and that's why we refer to as the lamellar bone, the lamellae of bone, layer of bone. And the center of that osteon is given a special name, and it's known as the Resorption canal, listed here. So Resorption canals are running in parallel direction to the cortical bone. But then there are channels which are connecting Resorption canals across, which are perpendicular to the long bone direction, and they are referred to as the Workman's canals. So in this ground bone, you can see that a little bit more clearly. So here are these Resorption canals through which the blood vessels and the nerves are traveling. And you can see these concentric circles very clearly. And then you notice here you have one Resorption canal here, one here, and then there's a channel which is connecting the two, referred to as the Workman's canals, we see here. So let's talk a little bit about bone resorption, and osteoclasts are responsible for that, and you will hear a lot more in terms of physiology of that in a different self-study. But here I just wanted to show you histologically what we would expect to see. So these osteoclasts are sitting on the surface of the bone, and they attach themselves to the bone by these peripheral areas referred to as clear zones. And to be able to attach to that, there are two reasons for that. One is to make sure that you have locality locked in, but also to allow this area here where the resorption is taking place to be isolated away from the other surrounding areas in the marrow space. And this is done through these integrin receptors which latches on the cells to the surface. So the thing to remember here is that these cells are able to move ions from outside and generate protons, and then move them down into an area where the resorption is going to take place. And to allow that efficient excretion as well as resorption of material, the surface of the cell is extended out, and it's referred to as the ruffle border, so to increase the surface area. So you have hydrogen ions here and chloride ions, so acidic environment in here is contained due to this clear zone, and that is what's causing the inorganic matrix to be degraded. But the organic matrix then is degraded by proteolytic enzymes like matrix metalloproteases, cathepsin K. The net result being that the organic and inorganic matrix is resorbed and then taken up by the cell and then expelled out from the other side. So it's like creating a little hole in the bone. So this is what an osteoclast looks like if you take a EM view of that. So here you can see the clear zones here and on this side here, and here's one of the nucleus of the cell, and then you see these lots and lots of lysosomal vesicles around here. And then here you clearly visible is the ruffle border of the cell and how the matrix, which is this dark area here, is being degraded right underneath here.